Let's continue around talking about smarter engagement and real-time insights, and let's leave sort of the farm and move into the city, so to speak. And I'm going to introduce you to Brindha Sridhar. She is the Vice President of Customer Experience Strategy at MetroPlusHealth in a small town called New York City. And she is helping drive meaningful improvements in satisfaction, retention, and trust. And we're going to, through a interview format, we're going to unpack some bright spots on how her team built a couple of different really interesting programs. So, Brindha, welcome to the summit here. Thanks for waiting so patiently. Let's start. There's the mantra, you can't manage what you don't measure. And so I know everyone who's listening to us right now in their organization, in some form, they're measuring member or client satisfaction. But tell us a little bit about how MetroPlus is thinking about measurement and what you're doing a little bit differently than maybe most plans are to make your measurement a little bit more effective.
Thank you, Eric. And I've really enjoyed listening to this esteemed panel. A lot of synergies, a lot of great opportunities were highlighted, and I'm excited to be back. I know we spoke a few years ago. MetroPlus, in fact, is now in its 40th year and has been dedicated to keeping New Yorkers healthy. We're based in the 5 boroughs in New York City, have over 700,000 members across Medicaid, Medicare, and exchange plans. And then specifically in the customer experience strategy team, which I lead, our goal is to do a few things very, very well. Number one is to understand customer insights, trends, the customer voice better than anybody else by developing meaningful yet actionable insights across the customer journey. And I'll talk to you about why that's so critical a little bit later. The second piece of that, once we understand these insights, we've got to do something with them. Our goal is to make these insights be translated to concrete strategies. And I talk about the word concrete a lot because we're always tasked with, we always come up with great ideas, but we're tasked with really making those insights actionable and making it something that we can implement. And the way we do it is by really evaluating where the greatest impact across the customer's journey is going to be if we were to improve that. And then we do that actually in collaboration with our cross-functional teams across the organization. Our team alone does not influence the customer's experience. It is a lot of customer-facing teams. It's a lot of medical quality teams that we work hand in glove with, and our operational teams. And then finally, measure. You can't manage what you don't measure. And I'm going to come on to those examples a little bit later. And then once we're done measuring how our projects are, in fact, performing, we will course correct, iterate, and expand from that place of strength. So that's really kind of a thoughtful method, diligent approach that we take to really solving any customer pain points that we identify. And then really getting to that specific point around the measurement and what you can't measure, you can't manage. A little over 2 years ago, we identified the need for going beyond your standard measures in an after-call survey that, you might kind of get over the phone to getting a more real-time customer sentiment analysis. And to do this, we started working with an external vendor, but doing it cross-functionally, not just the call center, so not just inbound calls that are coming in, but really looking across the board at every customer-facing team and every customer interaction. we send real-time texts at the end of a call to our customers. What this helps us with is we go beyond the quantitative to more qualitative insights around how the customer is feeling beyond the numbers. I think Jessica mentioned earlier that every part of the customer-facing organization, not just the call center, impact caps and retention. And that's very true in every organization, including ours. So we ensure that every customer representative that is in one of these roles is measured for the customer satisfaction, the Net Promoter Score, the employee rating that they provide. Our members actually rate our representatives on their interaction experience, their knowledgeability, their courteousness, their helpfulness. And over time, these scores really kind of are gathered across the organization, and we can identify who's doing it really well versus who's not doing it so well. Identify those best practices, those champions, those shining stars, and then ensure that we can share those learnings across different parts of the organization. The One of the things that we really learned across this process is not only can we continuously measure these customer interactions, but by doing so, we understand when a certain customer interaction is favorable versus when it's not, which a part of the organization has an easier time getting those high scores versus not, and what those root causes behind those interactions not being rated well or being rated well might be, so that we can continue to duplicate. Additionally, beyond that, more recently, so last year, now we all know that most of our customers may not call us. So how do we measure the experience of the members that are not calling us? We started building longitudinal customer surveys that really help us both from the member perspective, but also the provider perspective, really trying to understand how our members and providers are feeling about their interactions, whether that's over a phone call or not, with the plan. And then our goal is to understand which parameters that could be access to care, that could be the customer service line, that could be our network, how our customers are feeling about those interactions and the services that we provide, and then really trying to dig into how we can continue to improve that. So over time, what that helps us do is, once we understand that there's an area that's potentially underperforming, we have an opportunity to tailor strategies around that and then measure that over time with potentially seeing an increase and a statistically significant increase over time.
That's great. I mean, our prep proved well, because I didn't even have to ask you a lot of the follow-up. I mean, I will add, was there anything around the implementation that happened that caused you challenges? And was there anything that maybe, looking back, that you would have done a little bit differently?
I think you can work always to anticipate as many challenges as you could imagine, but you'll still have unexpected challenges. The thing we knew here going in, and we're very cognizant of, was without change management, this is not going to get implemented well, especially given that we have customer-facing staff that are going to be measured differently. The cross-functional alignment, holding hands on the need for doing this, and getting folks committed to that end result, that was critical. And over time, we continued to increase the engagement so that, if you've communicated it once, it's not enough. You have to keep communicating it, making people understand if their division was underperforming or if their division was doing really well, really trying to understand the reasons why. It also required then that all of the staff were aware of why there was this shift happening. So, typically you have your auditors essentially monitoring calls and really looking at how the calls are going, what the quality of the calls feels like. But this is your end customer directly rating your interaction if you are one of those customer facing members. So what that allowed us over time to do is ensure that our employees were really getting access to the types of insights that our members were providing. This goes beyond your 1 to 5 standard rating. It's really if someone considers you not helpful, or if someone thought that maybe you sounded a little bit short, ensuring that we were sharing that feedback in a very thoughtful manner with our employees, so that they understood why they were doing it, understood why they were being brought into it, and ensuring that, they see the value in being able to move in this direction so that everybody could be effective and everybody could continue to improve together. I think that was one very critical piece, not just getting the departments, but their leaders, the supervisors, and the staff bought in and continuously communicating with them and holding hands in developing those critical channels of communication. Beyond the change management, there's always an issue around the technological integration when you're bringing in systems like this. Depending on the CRM system that you're using, you're always going to need your IT colleagues lockstep with you. We've been very lucky. We have a fantastic IT team that works hand in glove with us, making sure that they're on this journey with you and are committed to making sure that system integration happens as seamlessly as possible, while knowing that there will be certain challenges. We've had some unanticipated hiccups sometimes, where perhaps a call that we wouldn't consider, depending on how it's adjudicated on our CRM, we wouldn't consider it to be a call that a call center rep would necessarily be measured for, might end up being the one that is getting maybe a rating. So really trying to get to the bottom of some of those post-integration implementation issues, and then just making sure that we're continuously course correcting. Every month, we're really looking at the percent of calls that are getting responses, and ensuring that because it's a ton of data, ensuring that there is a random quality check performed on these calls is always important, to ensure that you're getting the right kind of calls measured, and then ensuring that you're getting that insight back to your teams. But what's really interesting for us, by doing this over the last 2.5 years, we've actually been able to increase our overall net promoter score by about 5%. So if you can measure, you can manage, you can hopefully increase. And I think, as I forget, I think either you or Jessica mentioned earlier, take care of your employees and they'll take care of your customers. Ensuring that you do this entire change management process really thoughtfully, and ensuring that you're really sharing the reasons why you're making some of these shifts. It's really going to support your customer care in the medium to longer term.
Got it. Yeah, a lot of that resonates. What would be, if we were going to talk? Let's say we'll use Pareto's law here, and what's one area, if optimized, that can deliver sort of 80% of the impact with 20% of the investment or effort when it comes to the consumer experience and star ratings and everything that you're dealing with in the New York metropolitan market? And how are you approaching this? Like, where are you picking your 20? Where are you picking your spots to make the 80% impact?
Great question. So doing a lot of this longitudinal analysis and doing a lot of data and insight investigations, over the last few years, we've been very hyper aware that the greatest loss in retention, drop in retention, and one of the lowest net promoter scores we see, and the two are of course tied, is in the first 90 days of the customer's journey. Some of the lines of business we have, our members can switch in the first 90 days, which, tends not to be true in commercial plans and employee sponsored plans, for example. But this is where, we very consciously decided that we needed to needed to put a lot of our energy. So that's actually one of our second critical pillars of our customer experience strategy, focusing on the greatest area of opportunity in the customer journey, which, as I mentioned, is in the first 90 days. I can go through kind of some ways we've done this, Eric, or I don't know if you had a follow-up question.
No, go for it. I'd love to hear that.
So, in the early investigations we did, and we don't just do this through our surveys, we do this through a lot of listening, customer-facing interviews, research. We host member councils twice a year. We spend a lot of time understanding new member experience, continuing member experience, and listening to our members through these councils and surveys. We hear from our members continuously that they want information. Now, if you take that and you try to imagine the volume of information that a new member does not know, especially someone that's new to the health plan space or is not necessarily well versed because they haven't had the need, as much of a need for health insurance, we realize that dropping everything, all of that information, is tremendous cognitive load. That doesn't always yield the best results. I think people will still feel like the information that you're sharing is not the information that they're looking for. So there is a significant opportunity in understanding what the members are focused on in terms of what their need is, what questions they have, what they're most worried about when they're starting with the new health plan. So rather than overwhelming members with all of that information at once, we focus on navigating that journey through bite-sized information with a sense of measurement so that we understand which of our engagements are creating the greatest traction, creating the greatest interaction, and getting the most eyeballs. So we piloted a 14-step journey over the 90 days last year. Our goal was to really understand for new members what would work, what would make them tick, what would make them maybe not have the need to call us because they're calling with questions. And we wanted to ensure that, some of those questions for the people that would prefer not to call, if you will, were answered ahead of time. I think, again, one of the guests mentioned, please give us everything in one place. So how do we feed that information so that they don't have to go looking, and we're providing that information to them when we think we know they need it? We devised this 14-step journey, and it had every single step of that journey had robust engagement measures. Again, we stick true to our core principles: what you don't measure, you can't manage. Our goal was to understand simple things from a CRM perspective, like click-through rates, open rates, opt-out rates, every kind of engagement, but very interestingly also the rate of overall member calls that we were getting. One of our hopes going into this was that we would at least see the same number of calls, if not super high number of calls with this engagement, but we weren't sure. And I'll share with you a little bit later what the results were. But after the 90-day mark, we saw an increase in retention between the pilot and the control, which was great for us. We certainly wanted to see that. But what we believe is by lifting that curve of retention at the start of the journey, you're in fact going to be lifting the entire retention curve for these members across the 12-month mark. We're about 4 months into this pilot. We've already seen very satisfactory results. So we're going to scale this up. But, time will tell what overall impact we can imagine for this pilot in the longer term. We also recognize that while we needed an ongoing journey, maybe not every step in that journey was getting the eyeballs we were looking for or were probably seen as the most valuable. So we assessed the performance across those touch points and brought them down to 9. Very pragmatic. Try to keep staying engaged with your customer, but offer them information that they feel the most drawn to, the most willing to engage with.
Can I like, let me just, you've told a lot of great, I just want to summarize things for folks and make sure that, Brindha, that I've gotten it right. So it first of all, from an implementation standpoint, you front loaded, you had this 30, 60, 90-day approach.
Mhm.
You created a customized engagement based upon sort of personal values. And then you measured this, you assessed 14, you called them engagement touch points. It was a 14 engagement touch point program, and you looked at 14 different places for engagement, and then eventually took the 5 least relevant and reduced it down to 9. Okay,
Yeah.
keep on rolling. I got it. It's like, did I miss anything important there? I didn't want to over summarize or under summarize for our audience.
No, that's perfect. Thank you. Couldn't have said it better myself. But I think what we realized is by proactively communicating to these new members, we knew what they were looking for. They had questions around, when will I get my ID card? What are my benefits? How do I find a doctor? The greatest insight for us and aha for us was that we were in fact able to reduce our inbound new member calls, and by that too by 2%, which can have a significant impact when the pilot is scaled. Now, again, I think our first speaker, Kim, I believe, has the call center reporting up to her. That could be a really interesting opportunity. We're all looking for more quality calls rather than have large number of calls. So wouldn't it be great if we could try and answer a lot of those questions ahead of time so that members who want to self-serve can in fact do that on their own? So I think that was really the big aha for us. We've also seen a big increase in PCP visits, which is something that we try to support, which of course not just helps retention, certainly helps CAPS. And we expect, again, at scale, we can see a significant impact on the new member PCP visits as well.
So Jessica, I think it was Jessica who you're thinking of, who owns customer service. It sounds like you're a little envious of the model there, but it sounds like a good idea. You should be bringing that up. We know who the CEO is. That's great. Is there anything else about the program that we've left out here, or any big takeaways about the overall approach? I mean, it's obviously working, right? 5% increase in NPS. Any other trickle down effects, just to make sure everyone knows what's in it for them if they were to take a similar approach?
We look at a lot of engagement metrics on this across the organization. For us, most of you are probably aware of the TCPA rules that have gone into effect. Our goal was to not increase people dropping out of the program. We have not seen any alarming statistics. So I think from a risk management standpoint, that's a really good area of opportunity. The other piece, and I shared this in the first example of measurement and management as well, really bringing your cross-functional partners together on the journey with you right from the get-go. I cannot stress enough how important it is. And even for knowing it myself, I often could use the reminder to just do one more communication, one more conversation, just so everybody's aware of what the changes are going to be like. I'll give you an example. This is one for onboarding where one of the largest impacted teams is the call center. Bringing them along on that journey right from the beginning, right? They're your partners in the interaction. They see they see the new member calls, they see the new member volumes, they see the reasons and the frustrations that our new members might have. So really bringing them in, even in the engagement design part of the process, can be really powerful as a tool. And then when you're making the changes and the recommendations, yes, nothing broke. Nobody had to answer I don't know, 10, 15, 20% more calls. In fact, they came down. Ensuring that as you were running this pilot, the concerns that these teams have potentially of when a pilot like this gets launched, ensuring that they're heard and ensuring that when we're making those changes, they're all aware that, now that we're going into the scale up, every line of business is going to be going through this new kind of engagement. So really ensuring that that partnership is robust, and ensuring that, our IT colleagues are aware of the programmatic changes that are going to happen, really sets you up for the long term. And again, I think the biggest lesson I keep continuously learning is if you've communicated and you feel like you've communicated enough, communicate some more. So it doesn't hurt. If anything, your every program success that you identify, it'll only be as good as how much and how often and how relevantly you communicate to your key stakeholders.
So simple and yet so hard to do. And it totally resonates.
I'm still learning, Eric. I find myself going, I could have done that one more time.
Yeah. So one question I'm going to ask you now, but during the panel, and I'll just so you can prepare for it because we didn't really talk about it in our prep, would be, in your role as you own customer experience, what's the next, in sort of thinking about the future, what's the next big tactical or strategic implementation that you think is going to even further improve how great MetroPlusHealth's doing with consumer experience? So something that you're already beginning to work on, thinking about planning. And if there's nothing there, then the question would be reshaped. What would you want to be doing, if you had your druthers? So that'll be the question I'll ask you during our health plan final panel. Unless, of course, folks listening have questions for you, which of course you can use the Q&A module for. This was super insightful as I expected it to be. So thanks so much. That was great. Brindha Sridhar, thank you for sharing and translating all that information into strategy for us and how that makes an impact in New York City.